so in terms of the medications that you may be prescribed when you go to see your provider, I was on valcyclovir, and luckily I was placed on that within 48 hours because I kind of was like, this seems like shingles. But again, I'm a provider, so I take care of patients, and I've seen shingles a number of times in my career. So I'm cognizant. I think I was more cognizant of what was going on in my body, but hopefully these videos will help you to have that, just kind of piecing it together a little bit faster than you otherwise would. And there is acyclovir. Those two tend to be pretty well covered by insurance if you have insurance. So those are kind of go-tos as clinicians to get patients started on, and it really needs to be started on within the first 48 to 72 hours. In terms of the pain, because the pain is so much more intense than I thought it would be when patients have described this to me. So pain-wise, I have been using, well, what we can use medication-wise. Let me start with that. And then in the next video, I'll talk some more about some of the over-the-counter and natural products that I've been using that have been really helpful. I chose not to use any medications for pain other than ibuprofen, which I think I took twice, and it was very effective. I really needed it because it was kind of moving down both sides of my neck, and I was getting to the point where I couldn't move my neck, and ibuprofen as an anti-inflammatory worked incredibly well. So you could use ibuprofen or Tylenol over the counter. Other things that we tend to prescribe, we can prescribe narcotics, although in my experience, those are not incredibly beneficial. They just don't impact the pain at the nerve level, as well as some of the tricyclic medications. Sometimes we'll use amitriptyline, which can work well for patients as long as they don't develop side effects. And then another one would be gabapentin, which I've actually heard a number of patients and friends say that gabapentin was like a lifesaver for them. So that may be one to request or to talk to your clinician about if they haven't brought that up and you're experiencing a lot of pain with shingles. Additionally, sometimes we'll put you on a steroid taper. That's kind of not one of my main go-tos, mostly because of the side effects. With all of these medications, right, there tend to be side effects if you are someone that's more sensitive to prescriptive medications, which I am one of those people. So those are some of the standard medications that we'll try, particularly if your pain is really intense. And the more, as we know with pain, the more we can get on top and ahead of your pain, then the less medication you're probably going to need overall. And my experience was that the second week was by far the most painful. Like I would say between day 6 and day 10 was the most intense, with it just kind of wrapping around my head and going down the back of my arm. But I'm like, I think I'm day 12 or 13 right now, and I'm feeling finally like myself again. It tends to stay active in your body with the lesions, which will open up and then crust over for anywhere from 2 to 4 weeks. So I think that again just kind of depends on us as individuals. So that's a little bit about the pharmacology or the those options.